So we have Jack here. He's a 42-year-old patient coming here to get his neck and his arm checked on. He's complaints of lateral neck pain on the left side, parascapular pain, and arm pain running down his arm as well. He's got some paresthesia running down his arm past his elbow and then into his first and second digit. So we tried, after everything that we looked at, we tried a little bit of manual traction. It seemed to relieve some of the symptoms. So we're going to now work on some pneumatic traction or mechanical traction and see if that helps with some of the symptoms. Some of the indications for mechanical traction are going to be like nerve root impingement, disc herniation, any subacute pain, any narrowing of the intervertebral foramen, muscle spasms, any hypomobility, spinal ligament and connective tissue contractures, anything that's kind of keep them kind of locked in place. The contraindications are going to be anything acute, so acute sprains or strains of the cervical region, any acute inflammation there as well, any fractures, any joint instability, especially in the vertebra, and then while doing so, if there's any peripheralization of the symptoms, running down or extending further than it already is, then we'll immediately stop. Any spinal implants, any hardware like that, fusing joints together. Pregnancy in the lumbar region is also contraindicated. We're doing the cervical region today, so that's okay. Any osteoporosis or osteopenia is also a contraindication. I've already set Jack here up on the cervical traction. It's going to be pneumatic, so he's going to have a pump to actually be able to increase the amount of pressure that's giving him traction on his neck. I'll be controlling it. I'm just going to have it set to about 25 psi, I believe is what we're going to go with today. I'm going to check afterwards to make sure if any of the pain is going to either if it's centralized or if it I'm going to let him know if he starts to feel symptoms run down his arm further, then we'll go ahead and stop that. All right, Jack, how we feeling?
Feeling good.
All right, so you got your legs propped up, nice and comfy for you, right?
Yeah.
Okay, and everything else is secure already?
Yeah.
Okay, looking good. All right, so I kind of went over this with you already, the pump and how it works.
Yeah.
Don't worry about pumping it yourself. I'll be doing most of that.
Okay.
I'm going to get you up to about 25 psi, and then we're going to see how that feels. If at any point you think that's however far we go is good enough, then we'll stay there, okay? I don't want to push it.
Okay, sounds good.
All right. So we'll go ahead. How are you feeling?
Good.
What's that right there?
Perfect.
Perfect right there?
Yeah.
Okay. All right. So we're going to sit you here for about 10 minutes.
Okay.
I'm going to come back about 5 minutes. If you start to feel any numbness or tingling or any pain kind of extend past where you already have it, just let me know. Just holler. I'll be right back, okay?
Okay.
So go ahead and come back in 5.
Sounds good.
All right. How are you feeling so far?
Feeling really good.
Okay?
Yeah, I feel better.
All right. We're going to go for another 5 minutes. I'm going to pump it up just a little bit. Back up to where you need to be. Okay. All right. Stay there. All right. So we're done for the day. I'm going to go ahead and release this really slowly for you, okay? Go ahead and stay there for about 3 minutes. We're going to kind of let everything kind of calm down after we just pulled on everything. And then after that, we'll go ahead and get you up and on out of here, okay?
Sounds good.
All right, sounds good.